Pregnancy and high blood pressure. Know the facts. High blood pressure and pregnancy isn't necessarily a dangerous combination. But, with hypertension during pregnancy requires close monitoring. Here's what you need to know to take care of yourself and your baby. Pregnancy and high blood pressure. What are the types of high blood pressure during pregnancy? Sometimes high blood pressure is present before pregnancy. In other cases, high blood pressure develops during pregnancy. 1. Gestational hypertension. Women with gestational hypertension have high blood pressure that develops after 20 weeks of pregnancy. However, there is no excess protein in the urine or other signs of organ damage. On the other hand, some women with gestational hypertension eventually develop preeclampsia. 2. Chronic hypertension. Chronic hypertension is high blood pressure that was present before pregnancy or that occurs before 20 weeks of pregnancy. But because high blood pressure usually doesn't have symptoms, it might be hard to determine when it began. In particular, chronic hypertension with superimposed preeclampsia. This condition occurs in women with chronic hypertension before pregnancy. Furthermore, worsening of high blood pressure and protein in the urine or other blood pressure-related complications during pregnancy. 3. Preeclampsia. Preeclampsia occurs when hypertension develops after 20 weeks of pregnancy. At the same time, it is associated with signs of damage to other organ systems, including the kidneys, liver, blood or brain. Moreover, untreated preeclampsia can lead to serious, even fatal, complications for mother and baby, including development of seizures, eclampsia. Previously, preeclampsia was diagnosed only if a pregnant woman had high blood pressure and protein in her urine. Now, experts know that it's possible to have preeclampsia without having protein in the urine. Why is high blood pressure a problem during pregnancy? High blood pressure during pregnancy poses various risks, including decreased blood flow to the placenta. When the placenta doesn't get enough blood, your baby might receive less oxygen and fewer nutrients. This can lead to slow growth, intrauterine growth restriction, low birth weight or premature birth. Moreover, prematurity can lead to breathing problems, increased risk of infection and other complications for the baby. Placental abruption. In particular, preeclampsia increases your risk of this condition in which the placenta separates from the inner wall of your uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for you and your baby. Intrauterine growth restriction. Hypertension might result in slowed or decreased growth of your baby. Intrauterine growth restriction. Injury to your other organs. Poorly controlled hypertension can result in injury to your brain, heart, lungs, kidneys, liver and other major organs. In severe cases, it can be life-threatening. Premature delivery. Sometimes an early delivery is needed to prevent potentially life-threatening complications. When you have hypertension during pregnancy, future cardiovascular disease. In particular, having preeclampsia might increase your risk of future heart and blood vessel cardiovascular disease. Your risk of future cardiovascular disease is higher when you've had preeclampsia more than once, or you've had a premature birth due to having hypertension during pregnancy. Pregnancy and high blood pressure. How will I know if I develop hypertension during pregnancy? Monitoring your blood pressure is an important part of prenatal care. When you have chronic hypertension, your healthcare provider will consider these categories for blood pressure measurements. Elevated blood pressure. Elevated blood pressure is a systolic pressure ranging from 120 to 129 mm of mercury, mmHg, and a diastolic pressure below 80 mm Hg. On the other hand, elevated blood pressure tends to get worse over time, unless steps are taken to control blood pressure. Stage 1 hypertension. Remember, stage 1 hypertension is a systolic pressure ranging from 130 to 139 mm Hg, or a diastolic pressure ranging from 80 to 89 mm Hg. Stage 2 hypertension. More severe hypertension. Stage 2 hypertension is a systolic pressure of 140 mm Hg or higher, or a diastolic pressure of 90 mm Hg or higher. After 20 weeks of pregnancy, blood pressure that exceeds 140/90ths of a millimeter Hg. Results will be recorded 2 or more times, spaced at least 4 hours apart without any other organ damage, considered gestational hypertension. In particular, the simple exercises that lower high blood pressure. Right now, right where you're sitting, free solution. Link in the description. Thanks for watching. Good health. Do not forget like, share, and comment with us.